my role should really be to talk to you a little bit more about exactly how this disease presents or how this disease affects patients. And the bottom line is, as this slide depicts, it's a multi-organ disease. There's a lot of people that perhaps thought because of its name, aHUS, it only affected the kidney. I don't have to tell the people in this room that that's obviously not true. We affect all of these organs. The brain, the heart, the kidney, the GI tract, certainly the lungs and the pancreas also can potentially be affected in this disease. As best as we know, the kidneys are affected in 50 to 90% of children or in patients. And it is unfortunate that we have to leave that wide range of 50 to 90%, but that really is as best as we know. Obviously, as a nephrologist, I see plenty of children with atypical aHUS have their kidney affected, and I would say I'm probably on the 90% end. But I do, obviously, many of you will know it affects the kidney. It also affects the brain. There's certainly, and unfortunately, you're noticing that wide percentage out there also. But we can see stroke, we can see seizure, we can see fluctuating consciousness. There are lots of symptoms that actually can be attributed to this disease in both adults and children. Up to 43% of patients can have some cardiac effect. Many times this is severe hypertension. That's probably one of the #1 findings. But there also can be children that can get cardiomyopathy and myocarditis and a number of other cardiac-associated abnormalities that really become, a whole set of problems, if you will, that a physician must address that is independent of that hemolytic uremic component, if you will. Then there are 14 to 20% of children that have the GI tract that affected. Certainly I have seen pancreatitis happen in this setting, and you can actually even develop diabetes in this setting. And finally, it has been reported pulmonary hemorrhage can occur in these children, and those of you who have had children or yourselves have been on dialysis, you certainly know that pulmonary edema or fluid in the lung spaces is very definitely a risk for this population.